So many couples do worry about whether or not there are things in their lifestyle or their jobs that affect how fertile a man is, or how the quality of a man's semen at any one moment in time is. We know that some things are detrimental to good sperm production. So for example, men who work around chemicals that are sometimes used in paints or glues or printing inks, these chemicals are called glycol ethers. We know that men who are regularly exposed to these chemicals generally produce fewer swimming sperm in comparison to men who have other jobs. We also know that men who wear underpants that are too tight are more likely to produce less sperm that are swimming well. And that's almost certainly because the underpants have caused the temperature of the testicles to rise slightly. And we know that sperm production requires a cooler temperature. We know that men who smoke cannabis, who have regular exposure to cannabis smoke, also produce sperm that have poorer size and shape. And if the size and shape of sperm are wrong, that means they're less likely to navigate through the woman's body and reach the egg. So there are three things, glycol ethers, temperature and cannabis, that we know are definitely related to the quality of a man's sperm and will be detrimental to his sperm quality being the best that it can be. Now, there are things that I haven't mentioned that may be a surprise. So I haven't mentioned alcohol. And I think many men feel very guilty about whether or not a quick pint on a Friday night is going to be detrimental to fertility or sperm production. Actually, the evidence would suggest that if a man drinks within recommended guidelines, that there's really no harm to his sperm production and that there isn't anything to worry about. And I think that's important for couples to remember, because often couples go on a health drive when they're trying to have a baby and they cut out lots of things that they think might be detrimental to success. Men like to have a drink every now and again, and if couples cut out alcohol completely, then that can make a man quite grumpy. And when a man gets grumpy, he doesn't always want to have sex. And if you're not having sex, then you're lowering your chance of having a baby. So my advice would be drinking socially, a glass of wine each night with dinner or a beer with dinner is perfectly fine. What would be bad is saving up your allowance for a Friday night and consuming all of your alcohol within one go. So binge drinking is bad, but to drink with dinner or a drink out with friends once or twice a week isn't going to harm your sperm production at all. The effect of smoking cigarettes, cigars or a pipe on sperm production is really more complicated than people at first might think. There's not a lot of evidence to suggest that by smoking you reduce the number of sperm that are produced by a man. It seems to be that most of the studies suggest that sperm production continues at a similar rate than what we see in non-smokers. So when we look down the microscope at the semen of men who smoke, at first glance we don't see any difference in comparison to non-smokers. The sperm also seem to swim just as well, and they also have size and shape that's also very similar to that of non-smokers. But if we make more detailed observations of the DNA, the genetic component of the sperm, and that's what sperm are built for, to carry the man's DNA to the egg to create a new life. When we look at the DNA quality of smokers, it really is less healthy than non-smokers. The DNA is more likely to be chopped, damaged or disorganized, and the influence of that will be more likely to increase the risk of miscarriage or potentially increase the risk of not getting pregnant at all because the sperm DNA isn't working correctly. So the advice to smokers really is that you should stop smoking if you're trying to conceive, because we know it takes 3 months to produce a sperm, you should stop for a long extended period of time and allow all those toxins to get out of your body and allow for new healthy sperm to be produced. And I would argue more than that, you should probably stop in the long term, because if you are successful and you have a child, then smoking around children is not something that we would recommend.